we see a lot of activities, of CSOs, NGOs concentrated in urban areas. I don't know if you've noticed some things like that. Okay? But how can we ensure that universal health coverage benefits the underserved communities rather than being urban center focused? I take some examples like we have some communities in Delta State, for instance, that you do 2 hours on the boat to get to. We don't see CSO activities in those places. But you may educate me better.
Okay.
Thank you.
Thank you very much. I beg to differ. CSOs, CBOs, FBOs are everywhere. They are everywhere. So you cannot say that CSOs are not in the... You just want me to talk. Anyway, the marginalized, to start with, what they have is immunization. Because first and foremost, they are already poor. They can barely feed. So what they have that government gives them for free is immunization. That gives to their children for free is immunization. The National Health Act and the Vulnerable Group Fund by Senator Oloriegbe, it speaks to that directly. So, and then the Basic Healthcare Provision Fund, the government has a catalytic fund from the Basic Healthcare Provision Fund that caters to revitalizing about 7,000 primary healthcare centers, and now they want to revitalize it up to 17,000. But guess what? 17,000 primary healthcare center is a far cry. So it is very important that all hands are on deck. So, and then I wanted to just state the fact that this is where PPP comes in. It's a catalytic fund, means that government is in charge, is talking, and then other people join. And then the primary healthcare centers, or primary healthcare as we see it, needs funds. Let me speak like a worry girl that I am. Now money I make I on float. So at the end of it, the government is on the driver's seat. We have to fund UHC. The poor need it. And the funds have to come out. The government has to be at the driver's seat to do that. And then the PPP, please support us. CSOs are also going to be there. Right now, as we speak, I don't like saying the immunization funds have not been released for 2024. As we speak, let me give an example of vaccines. If there's a shortage of vaccine, who are those that will suffer? The poor and the marginalized and the vulnerable. So my appeal is that the vaccine funds should be put somewhere. We shouldn't play with it. It should be a predictable fund. Maybe like first line charge, whatever it is. Put it somewhere to make sure that at any point in time, the first one is have money to buy them. Because that is one of the indicators of primary health care. But after that, when I talk about demand generation, where all of us together will start to create demand, continuous education. And then there's a program which we have. I like to speak with examples called Adopt a PHC. And there are big people that are talking about Adopt a PHC. But what we're talking about is we want the people in the community to adopt a PHC. So let me give you an example. There are these Umuadas in one community in Imo State where they got a grant from one of organization, 15,000 naira. They got a grant. And they decided to use 500 naira out of that grant to support their PHC. They bought a weighing scale and a BP machine. Immediately, they become accountable. Every week, you see them going there to go and monitor their scale to make sure that the scale is being used. So that is what we're talking about. We want all of us here, adopt a PHC near you. Adopt and start to ask questions so that the poor and the vulnerable will be catered to. That is where, creating demand, sensitization, awareness. Don't give up. Let all hands be on deck. PPP, please help us. CSOs, we are there. And then the citizens, it's about them. Nothing for them without them. Bring them on the table. Let everybody, by the time all of us become passionate about our PHCs, we are all asking questions, doing what we need to do. You will be surprised what will happen. So my own here is hands on deck. That is it. PPP, CSOs, FBOs, and citizens. Thank you very much.
Thank you. Thank you. But I like the passion with which you spoke about the citizens adopting PHCs. I think people might want to know cost implication to that effect. What could be the most minimal cost to get involved in such a venture to adopting a PHC in your local environment? So that, I mean, let's break it down if you can.
So let's break it down. The government has their role to play. So we don't intend to do government work. So usually the states are usually involved, or local government. So we develop together with the government an implementation framework where we know exactly what the government is supposed to do and what is left. So is that what is left? Let me give you another example. In FCT in Abuja, so there was FCT came together with private partners and agreed that this is what the government can do and this is what is left. And based on that, the private one organization, a restaurant owner, Biobak, if you're in Abuja, you would know her. Biobak decided, oh, you know what? I don't want to adopt a PHC that's already being funded by Basic Healthcare Provision Fund. I want to adopt a PHC that is not funded by Basic Healthcare Provision Fund. And these are the things that are left. So what did she do? What was left was to fence the place because thieves were attacking and people were not coming for immunization, were not coming for ANC, they were not coming for those things. So she spent like 3 years, but managed to fence the whole PHC. Not only that, she repaired the toilets as well. Of course, in collaboration with the government, she repaired the toilets. Do you know that just these two things that she did, ANC services improved from 50 to 150. Do you know what it means? It means the lives of over 150 women every week are saved. When we went there, I saw the in charge. Do you know what it means to work in a PHC and love your job? Many of these people love their jobs, the health workers, but the system, the whole environment is not conducive for them. They had a big toilet. By the time Biobak renovated 9 of the toilets, I went there and I saw a happy environment.
Thank you.
I saw a happy environment where the in charge told me, Chika, see my key. I even have one toilet to myself. People that were coming for ANC were happy. So this is what we're talking about. It's not only about going. How do you make them feel such that they continually visit the primary healthcare centers when it is necessary?
Thank you. I mean, I like this. We can go on and on this subject matter, but, again, we're talking about bridging the divide, closing the gaps, so we can attain universal health coverage. So people from old boys associations here, people, you come from communities, your old boys association can decide to renovate a PHC, re-equip a PHC, and make it functional.
Yes.
And you would have done, something noble for that community. Thank you. Thank you.
Communicate with the government so that you don't do government work.
Yes, of course. You talk to the people at the local government area and they will direct you accordingly.